Hi, everybody. I'm here with Q the nurse, and I'm very excited to share this guy with you because he's so active on social media. He's very clued into Instagram, TikTok, YouTube. And today we're going to talk about what he looks for in jobs and how he thinks recruiters like you can advertise better on the channels that he's an expert in social media. Do you want to introduce yourself, Q?
Yes. So my full name is Swadik Mayanja, but I do go by Q. And yes, I am Q the nurse. Woot woot. I've been a nurse for 3.5 years, 3 years and some change. Uh, as soon as I got into nursing, I was like, yes, this makes sense to me. And I wanted to share it with the world. And I shared it in every social media, every person I talked to, I let them know. It's probably the second, third, and 10th thing I tell them. So I love my job and I try to share it in as many places as I possibly can. And that's why I am heavy on the social. So I'm very thankful that you guys reached out. Thank you very much.
Well, yeah, I'm just looking at your YouTube channel now. We have TikTok compilation, uh, going from nursing assistant registered nurse down to nurses playing cards. So covering the full spectrum there. What I
Yes.
want to focus on today is really the job market, and in this series we want to educate recruiters to help them become more social media savvy and also just more generally savvy about what nurses want these days. So I want to start by asking what makes a nursing position attractive to you?
Um, so I have to start off with the truth and the truth alone. So me being a young nurse, uh, money is obviously the first and foremost thing I'm looking for right now. I'm in the uptick of my career. At least I like to think of it that way. So you have to be competitive, right? And if you're not competitive, the other things I'm gonna say you got to lean heavy into. But the first and foremost, you've got to be competitive. But I'm assuming that everyone is, and I'm assuming per that market, your the whatever company is. Moving forward from the money alone, I want honesty. Honesty is key, right? You can't tell me to expect something. I get to the job and see something else. I hate it the second I get there. I mean, it's just that point blank and simple. And specifically, it's this one thing that has happened to me many times is especially with nursing facilities that tell you this is the expected nurse to patient ratio, and then
Mm.
your first day on the job you have two more patients than they told you the max was going to be. That hurts the soul. That hurts. That really is frustrating. It puts my license at risk. It doesn't feel good. So honesty, honesty, honesty on top of being competitive.
Okay, let me ask a couple of follow-ups. Number one, a lot of hospitals these days are offering 5 or 10,000 sign-on bonuses that pay out over 2 years. Is that an attractive thing to you, or are you kind of thinking about what the salary is like on a more long-term basis?
That is a great question. And it depends. Right now, I'm a travel nurse. So the the sign-on bonuses that I like right now are we need someone to work in this emergency room department that has heavy trauma patients that might have all the COVID patients. Yes, I will sign on for that bonus. For me specifically as a travel nurse, someone who likes to bounce around, the length of time, but this is a very specific thing for me. For the length of time for me is something I do not ever want to sign up for. I never want to be tied down to a place, but that's my very specific want need situation in my life. The minute I am done travel nursing, that would be a very appealing thing to have. When I decide where I want to settle, and if there's two hospitals I'm going between, and one of them says there's a $10,000 sign-on bonus if you stay for 10 years and you get it paid through a 2 year period. I'm in there. I'm listening. I'm all ears. What else do you have for me? Please and thank you.
Mm, yeah. Okay. So whenever you look at ads, if you think about more like a permanent position, what would make a job ad stand out to you?
Yes. It's really funny that you say that, right? Because I have yet to go to a job application because of an ad, right? And this is really funny to say. The thing that gets me the most is um, it's definitely word of mouth. Nurses talk a lot, and it doesn't matter how big or small the community is, right? Nurses know everything, right? At whatever hospital you work at, there's at least 5, 10, 15, 20 nurses that work per diem at a different facility at work, or at a nursing home at work, at a health clinic. And that's how I have heard, or, went from one job to the other. The only time ads have ever caught in my eye is when I've already heard of the hospital in the grapevine, right? Everyone talks about Boston Medical. Everyone talks about Boston Medical. And I see a
Mm,
big poster that has Boston Medical with happy nurses smiling. And I'm like, you know what? They're having a job fair. Let me go check it out. But the truth is, have I turned on the TV, seeing an ad, and been like, oh my goodness, there's a hospital opening? That's a hard ask. That's a very,
mm,
very hard ask. It's a very hard ask.
mm. So like to get you from not aware of who they are to applying, it takes a little bit more than just
A
an ad.
great Yes. And like, listen, it's hard. It's hard because it's a career decision. It's a job. It's a big decision. So the ad would have to be like perfect,
Mm,
to get me from I've never heard of this hospital to maybe I would like to work there.
yeah. And whenever so say you saw the perfect ad,
Yeah.
like is social media a big part of your research process where you would look on their
Oh
pages and
yeah.
their presence, or is it more like corporate formal stuff?
Uh, uh Definitely both. So I'm going to go to the hospital's website. I know it's corny and cheesy, but that
Mm,
mission statement, that vision, it
yeah.
matters to me. It really does matter to me. If your mission statement is we gonna make the most money from our patients as we possibly can, deuces. Thank you, but no thank you, right? I, the mission statement is like if I can vibe with it, if this is something I can tell my patients every single day, I am here for this reason, and I can paraphrase that mission statement. Ooh, that makes me feel good inside. That makes
Mm,
me feel like I'm part of a team and I'm not just doing my day to day 9 to 5 head down like a zombie, right? The mission statement, the vision, all of those things are corny and are like this big picture up in the clouds, head in the cloud stuff. But it really is the thing that can it, it makes my day feel worth it when I have those really hard days at work, right? It makes
mm,
me feel proud of my job. It makes me want to tell other people, like I said, word of mouth about the job. So catchy, not so much, but thoughtful and honest, right? If it rhymes, great. I'm happy that you got that. But if it
yeah.
means something, right? If there's something I could hold on to, that's when I'm like, yes, like I'm down. I'm down.
So we work with one hospital system, and their line is our nurses care like crazy. Do you like that alliteration?
Are you being serious? You're not lying to
Yeah,
me.
yeah.
That's
I think
that's
it's
what they
good.
listen. I have to see it. I have to understand it. I have to see the context.
Yeah.
Our nurses care like crazy. I like it because it's real, right? Like I said, they're not trying to be all fluffy and good and in the field.
Mm,
So I need to know a little bit more. But I'm
yeah.
here. I'd listen. I'd listen.
Okay.
I'd listen.
Got your attention.
Yes.
So let's talk a little bit about social media then. Um, is that whenever you go on a hospital page and they don't have anything,
Mhm.
does that matter to you? Like, are you
Oh yeah.
questioning things or what?
Yeah. Yeah. And uh, I like to think of myself as a young hip millennial, but I don't expect the hospital to have like the greatest YouTube page or their Instagram is popping or any of
Mm,
this stuff. But social media is social media. I mean, they call it social media because you're joining the community. You're part of what's happening. You have your ear on the ground. So if your hospital is too hoity-toity, too good for any social media, then I'm like, especially like you just introduced, like in the introduction, I'm heavy on social. If the hospital system is also doing social, and I could throw a tag in, or I could, DM them, or I could do something where it's not so formal, and I can try to get to know the facility, the people, the coworkers, my future colleagues. in a way that's not suit and tie, handshakes, nice to meet you, it is nice. So if I don't see anything, I'm not going to say it doesn't turn me off, because I'm not going to say it turns me off. I'm going to just say it's better if they have it. It's
Mm.
better if they have it.
And if they do have it, what about it would make you say, "Oh my goodness, I want to work there"?
Yeah.
What sort of content would make you go wild?
There's two things. I like to see variety, because a hospital is a big place. A facility is a big place. So if they have multiple social media platforms and it's the same video on everything, thanks for trying, but no, right? Variety in like the actual content that is on each platform, and variety in what that content is when they post. So I would love to see a doctor have a conversation with a nurse. I would love to see the CNO or the CEO talk to a patient or a patient's family member that's willing to have a conversation. Like, I want to know what the relationships are between the people that work there and between the nurses and the healthcare workers with the patients. I want to see what that's like. And if I could get a glimpse of what that is, I would like to say, I could be like, I would want to be a part of those kind of relationships. I'm not a fan of that. Right. So that's what I want to see.
I actually haven't seen that so much, showing the relationships between the different actors in the hospital. I think a lot of hospitals are kind of afraid to represent that, because it could be opening their brand up to some comments. Like, I don't really know where I'm going here, but I think there are certain barriers to the hospitals being better at social media. As a nurse, are you kind of like aware of, for example, a lot of hospitals don't want to share their staff to patient ratio because it might look bad, or it's not for public consumption. Are you kind of acknowledging that and you think that's fair enough, or do you believe that no, they should be transparent with us nurses, like we need to know this stuff, it's really important?
That's a good question. That's a really good question. In the patient ratio aspect, I think that's a hard one. That's a really hard one, because in some facilities, the nurse to patient ratio could be 1 to 6. And like in my head, especially in a high acuity hospital, that to me sounds heavy. But if it's 1 to 6 and they have a floor CNA all day, every day helping around, if they have a charge nurse, if they have a teletech, if they have our respiratory therapist that's coming to help, that's a very different situation than a hospital that says it's 1 to 4 but have no help, right? So context matters. So you're right. If they just were to just put it out there and just say 1 to 5 or 1 to 4, that might not be useful in anyone's situation, right? I might have the judgment. I might prejudge for no reason, and they might be lying or just not telling they might be telling the truth but not explaining the context.
Yeah.
What I'm saying is, you need to be honest. I think they should, if it was up to me, you should be as transparent as possible, but with context. Explain what your 1 to 5 is. Explain what your 1 to 7 is. Explain what that looks like, what that feels like, and how those nurses appreciate, don't like, what they would change, what they wouldn't change. If you're just transparent and honest and give them context, then maybe I'm like, but I do hear you. It is a hard thing to do. And especially in an ad, like a 30-second, 40-second ad, you can't really give all of that. But yeah, it's a hard one. It's a hard one.
Yeah, I think that's good about the context. If they said you have a CNA on the floor and all those other things, that will make you a bit more comfortable, right?
Exactly.
Okay. So I want to talk now about TikTok before we go. I have seen some recruiters try TikTok. Obviously, a lot of people our age are on that new social media, and it's very much an unknown for a lot of brands, not least the healthcare kind of sector. How, well, let me get my question there. How do you think healthcare recruiters can use TikTok to attract nurses like you, if at all?
Um, I've been having a really hard time with TikTok, period, right? Especially like you said, being a healthcare worker, there are some TikTok videos I see of healthcare workers, of nurses that go viral, of whatever that go viral, that I get a little uneasy about. I mean, we work in healthcare. HIPAA is our like end all be all, right? So when I see nurses or healthcare workers making fun of patients, mocking patients, and not obviously having them on screen, like all of that kind of stuff, it rubs the wrong way. I'm not saying it's wrong. I'm just saying some of it doesn't feel totally right. But when it comes to just the recruiters or the hospitals or the facilities trying to recruit nurses, I think, listen, there's very few things that nurses like, and just put a bright light on that, right? Show us the therapy dog. I love the therapy dog. Show me the therapy dog, right? Tell me, show me the snacks and the pizza that you give, right? Show us a really quick dance or a funny thing that the nurses are doing outside if they have their break, if you have like a grassy lawn that you have. To show me the, what's it called? When all of the nurses dress up for Halloween or something. So like literally TikTok is supposed to make you fun, like it's a 30-second, 15-second video of a happy thing, right? Any of the, like anything could happen, but I don't think you should overthink it. But at the same time, I just careful when it comes to trying to be funny, especially at anyone's expense, especially a patient's expense. But I really think just lighthearted stuff, anything lighthearted on TikTok. When I go on TikTok, my mindset isn't I want to get to know the details of this facility. When I'm on TikTok, I want to say, what are the fun things that the nurses and healthcare professionals do at that facility?
Yeah, that's great advice. I hope that spawns like 50 posts of pizza for people who watch this.
We love our pizza parties.
Yeah.
If you're a nurse and you don't like your pizza party, are you really a nurse?
I didn't know that. So before you go, if you could give a message to healthcare recruiters out there who are struggling to find nurses and convince them to come and work at their organization, what would it be?
So we become nurses because we want to help people, right? And people are people. So when all of these recruiters come up to you with like their business suits and they're so professional and they ask for your resume and it's like they're a robot and like we can provide you with these benefits and this is gonna, like, yes, of course we need to know that stuff. Yeah, put that in the fine print, put that in the background, give me a piece of paper, I can read that for myself. Well, that's not what I'm looking for you to share. What I want you to share is the people. And if you can't share the patients, of course, that's HIPAA. That's a decision, obviously. Like it's law. You can't do that. But share the people I'm going to work with. Share who my boss is. Share what they like. Share what they don't like. Share like their day to day. The best part of the day, the worst part of the day. How do they come to work? Where do they, like all of the little things about the people we work with. That's why I became a nurse, because I like to hang out with my peoples. I like to talk to my people. So I'd tell all of these recruiters, remember why we became nurses and remind us of that in all of your posts. And maybe, just maybe, you'd be lucky enough to have me apply.
I love that. That's an excellent response. Thank you so much.
Oh, of course.
I definitely think that's lacking even in some of the ads that we make. It's so easy if someone says like we have a $5,000 sign-on bonus to lead with that and forget about everything else. Just put that in every line. So thank you so much for sharing that. If people want to connect with you, Q, where can they do it?
Super simple with me. It's literally the letter Q, then the nurse, no space, no anything, just Q the nurse, and that's basically me on every social. And yeah, I'd love to chat with recruiters and other nurses alike. I'm here for it.
Great. Well, thanks so much for giving me your time today, and all the best in the future.
Thank you.
Talk to you soon.
Will do.
Bye.
Bye-bye.